These are the ones that can potentially save lives. In all this data that is collected from the patient, we want to extract the pieces of information, number one, that are going to allow the physician to make a clinical decision, but at the same time, to identify certain risks for disease. Whether it's that physical illness or mental health or mental illness, we are developing those kind of tools to facilitate that process.
Hey everybody, it's Stuart Smith with SmallCapVoice.com, and thanks so much for taking the time to join us here for our online business briefing, where today we're going to be speaking with Dr. Marcos Sanchez-Gonzalez. We've spoken with Dr. Marcos before in the past, as well as the CEO for the company, Troy Grogan. The company we're speaking about today is QHS Lab Incorporated. They're traded on the OTCQB under the ticker symbol USAQ, and Dr. Marcos Sanchez-Gonzalez is the Vice President of Medical and Scientific Affairs. And if you want to know what QHS Lab does, then go to their website, which is exactly that, qhslab.com. We're going to be talking about a certain part of that website today. If you click on the menu at the top, you can find assessments. And within that assessments tool, we're going to be speaking about a new tool today, because USAQ is a leader in digital health and point of care technologies designed to empower clinicians with proactive value-based healthcare solutions. But you don't want to hear that from me. You want to hear that straight from the company. So welcome to the show, Dr. Marcos. Good to speak with you again today.
Thank you, Stuart, for this and having me here.
Yeah, absolutely. So I mentioned a tool within a tool. And so you have assessments, and under that assessments tab, you have mental health assessments. Now within that, your company has launched a new tool, the imminent risk alert. I don't know if you've called that the IRA for short, but I started doing it here as I was preparing for this interview. So let's talk a little bit. I watched a video with you discussing this as well, and we'll make that video available to everybody as well. But there's quite a bit going on here. We'd like to learn more about it with you.
Yeah, we're very excited to expand our line of digital medicine products. So we were looking into not only help patients live better and get better, helping physicians and helping providers in the clinical decision-making process, but this is a very exciting kind of new line of products and services and enhancements. We call them enhancements. These are the ones that can potentially save lives. And it comes from the principle of basically in all these data that is collected from the patient. So these are, as I mentioned before, patient-centric technologies. We want to extract the pieces of information, number one, that are going to allow the physician to make a clinical decision, but at the same time, to identify certain risks for disease, or whether it's that physical illness or mental health or mental illness, we are developing those kind of tools to facilitate that process.
Well, let's talk about that, because you mentioned the patient and what they need to do. So when we talk about this new imminent risk alert, it is geared towards the mental health side, I would assume, or is it actually broader than that? Is it for the physical side as well? Tell me about that delineation.
So we have a alerts per se, and then we have different tiers of the, I want to say, how severe that alert might be, or the state of the patient. So the imminent risk alert it's a feature that goes into a mental health assessment, specifically a tool that we call it PHQ-9. It's a standardized tool for depressive symptoms. If the patient has high depressive symptoms and answer positive to one of the questions that have to do with self-harm, the tool automatically adapts to that and sends the patient another series of questions to assess their suicidal thoughts. And this is kind of tools that pretty much save lives. If the patient answers in a positive way to that, it converts that encounter into a medical emergency. So basically stops assessment, provide the patient with certain tools and guidance on what they need to do. And in that case, it's pretty much hang up, call 911, seek help. And at the same time, the physicians are getting or the providers are getting emails, notifications, and text messages that there's a patient that really needs help. It's a medical emergency.
So let's talk about that part of it again, because there are responsibilities on both sides. So this is an enhanced screening process within this tool that creates this imminent risk alert. So let's talk a little bit about how the screening process may have an impact on the patient's rights, their responsibilities, as well as their privacy. Obviously, you talked about the responsibility is up to them to hang up the phone and still call 911 or a suicide hotline to receive the help that they need. But again, let's talk a little bit about the patient more and how this screening process can assist them and get them to the care that they need.
Yeah. This is an excellent point. Many of the digital medicine enhancements, number one key here is that it's a secure platform. So inside the patient's rights, you have the right to have their data safe, secure, that is not used for other purposes other than the healthcare needs. So we have to guarantee that inside the platform and in the system that we have. And again, the company invests a lot of resources to make sure the platform is safe and secure. Inside these assessments, there's always disclaimers to the patients that this is information that your healthcare provider is asking to access from you, and it's part of the medical encounter. So there's what we call an informed consent as part of the initiation onboarding process when the patient start answering these assessments. So it's a voluntary, but at the same time, we're letting them know that this is an information that their healthcare providers need to provide the care they need. So once you have into the different assessments and questionings, it's important to mention that, especially in these imminent risk alerts and how this is been working with these enhancements, once the patient is identified as suicidal, it becomes a medical emergency. So now there's a series of things that start to change. Number one, the responsibility of the provider changes because it's not a mere medical visit. It's a medical emergency. So just to have an analogy here, when you call to your provider and there's an answering machine, the first thing it does, it goes to, if this is a medical emergency, please hang on and call 911. Why is that? So that's part of the regulations and the standards of care. And also it relays, or it basically takes our responsibility from the provider. Because if the patient is calling, let's say, physical illness with a heart attack, okay, or myocardial infarction, so the patient should call, the patient has that responsibility to call the corresponding party for that particular care need. In this case, it's an emergency. Medical emergencies, whether mental health or physical, they are treated very similar in that sense. They still in emergency. They need immediate, that's what we call the immediate risk alert, immediate action from the different parties. As far as a company and we're providers, we're giving the patients all the tool they need to seek help. The platform automatically stops that encounter to basically skips every single question that doesn't represent an emergency. So this transcends everything else in this encounter. And as I mentioned, the very first thing that it goes into encouraging message to the patient that has been developed in conjunction with our psychiatry team and our scientists. These are evidence-based tools. And then here's 911 and it's active. So they don't have to go outside the platform, do anything else. They just can press the button and they will be contacted to 911.
Well, Doctor, you joined the company in 2024, and I would encourage everybody to review the press wire of 2024 for USAQ. That's the ticker symbol again on the OTCQB. But not only yourself, and I do see QHS Lab growing in its offerings by bringing yourself on, but also in October 2024, and I hope I pronounced their last name correctly, Dr. Juan D. Ohms, in October 2024, a board-certified psychiatrist with an extensive expertise in behavioral health and substance use disorders. So I would assume, besides yourself, Doctor, that Dr. Alms also worked on this project. Besides the two of you, were there any outside contributors, anybody consultant-wise that worked on this with you?
Yeah. And we have this is a group of people that has been collaborating in the different tools because we're evidence-based first and foremost. So as we get into the medical or mental health arena, we thought, well, we need to bring the experts. We need to bring the experts in the area. So one of the first people that we started working was with Dr. Juan Oms, as you mentioned. He's a board certified a psychiatrist. We also have collaborated with outside the company scientists that are expert in suicide prevention and suicide research. The examples we have researchers from University of Central Florida. We have the Florida Alliance to the Prevention of Suicide. We've been contributing or collaborating with them, make sure that the messaging inside or behind these tools are evidence-based and effective to, again, avoid the tragedy. And we also have a series of a junior scientists and senior scientists behind the scenes, as I mentioned, that before we put a page, a resource, an assessment out there to the public, to the patient, we have done our homework and our due diligence in terms of what are the most effective, efficacious, safe tools that we can provide to the patients to make that difference. So when we deploy the tool, we have done exhaustive research and we have done our homework in terms of making sure that the tool, it's going to do what it was meant to be or to do. In this case, identify the risk, and hopefully we can prevent a tragedy to happen.
Yeah, and I should mention as well, go again to QHSLab.com, click on the assessments tab. You can find their mental health assessments, and you'll see a beautiful picture of what's available in the App Store, the Q scale, this is also part of this tool within a tool that you don't need to be in front of your desktop. You can have it right there on your personal device, on yourself, because we know this doesn't just happen at home, these situations. We know that things can happen at work. They can happen in our social lives, that just flip a switch and, we need that help. We need that outside care. So let's move on then a little bit. Let's talk a little bit about the feedback you've gotten as well, because you talked about the outside collaboration. And you and I were in discussions as we prepared for this interview, and you told me about your calls that you've had scheduled with NAMI, and that is the National Alliance on Mental Illness. How have some of these outside collaborations and some of the outside input that you've gotten, how has that progressed? How constructive has it been? And how has it helped the launch, which I know it's been a very recent launch for the Imminent Risk Alert?